if I said we hear me say on TV since you said was now do no should say you know vision na blade ubo say ube nante kakra kwa ube no wa bre e dey na eba mesoi we say oh menum kra to na it comes with a whole lot of things and then come bona ebebo no ubo so obi betimi aka say oh ye type 1 ebi say o type 2 ha what say once what dey no and ye share diabetes mellitus enti baby bia wo bia no me so tweben wa fidie na yenye enkomoboy mu nchiremu de bia me kasa me de me nko eni ofrene sen e ba yen apomuden ehu school nom ne ade a me nko bi me nkonko je nteteye media ne say mostly no I read a lot to acquire knowledge and I say enim defo no me no mu di nkomo a na me ginchim na me bisa questions na me ginchire mu ye na me so me nya ntiase na me sua bibi enti da no aya ye pen nim defo mu adosuko e wo yapomuden mu no maba be ma ye nchirichiri mu enti bia e na ye no enne no hye no so your WhatsApp line here active 0558656899 eno esa ye call line ebrebe mu a ye be ye ahomatofo na tum na wo so afre na this see no nkomobone ko se bia ntantem so pe anu yie ewo wasem bise ho a kruche na fabra na mimisa doctor emam na wo mayen awon so wanu yie so ntentem so ne me di jumedi ho cha me din de abena chi bo wa che no so see streaming live on YouTube at Kantanka Television and then on Twitter at Kantanka TV as well betimi a share every sa emia we nyina honom say the medical can ye share and I say na ye kasafa diabetes mellitus Dr. Ibrahim Osman ube piemu ewo Nature Blend Clinica ono ne panyin kwanchefo a woda no or cafeteria kama so mo organic foods nko a nti ubetimi akọ nso no akọ didi ene doc na me ne chinkoma afa ya pomoden ho doc me mo akoba baby aboko de ready ado o ho ayi fa na pay oh me that say na baby boy nso what to say
wow he's doing good.
Hey yeah toy boy and I'm boy hey yes we dey wu junior
back on junior
oh okay oh the two boys
yes
oh wow okay very soon two girls the same
black star
oh okay dog and they say it's a diabetes mellitus and you bia your specific people are with me enya ewo mumu ana
all right me that say we did a very nice question pa you can say diabetes mellitus a group of conditions and I are ahodo bebre emma nipadua no entimi use glucose and sugar wo nipadua no eyi o say you can say glucose and sugar very very important emma nipadua no and need the energy source enti say sa glucose no say bi enni nipadua no mu ahoden enni ho enti before glucose no so no betimi ama ahoden anase ebema energy no aba nipadua no mu say efa insulin bi efa hormone ayefre insulin so enti through the insulin enema glucose etimi cells no mu na etimi abene for energy na because of say yare ahodo bebre etimi eka nipadua no na ema nipadua no etimi use sugar ni ye nti anase empo se ebema hormone no insulin no ankebe ebe release from the pancreas na ba nipadua no to regulate the sugar level anase glucose level no enye papa ntini etimi nipa ni bi etimi nya sugar anase glucose eboro so ewo omu emoja mu ayebeka nti I do that time na ya time the diabetes but ne wom ni say with the diabetes no ye one types and concerning any type affect you bia liable say ebetimi ama asichira ayeden adults ewo nipadua mu ye wo bibi to say pre-diabetes no honom no nipa no nya diabetic but we in between the normal and the abnormal range enti ehonomo no sa eno that condition no so no se nipa no ya if care is not taken steps now they are taking it very fast or betimi abaye a total blown diabetic patient enti ehonomo no ehonomo ya na mfomuso bebre etimi eba because practitioners need be no when who said the person the pre-diabetic instances bebre na ye say ye tro diabetes a draw at the man but ehonomo no mainly the lifestyle changes. nti nipa no or pre-diabetic and as a pre-diabetes the obeya ne say ne lifestyle bi say a lifestyle and as a impose a genetic aspect say obuwa ne didie mu because we have environmental factors that can also affect so enti no ehonom no ye medru you regulate nipa in the lifestyle they do and oh we are prone you can ubetimi be fully blown diabetic ain't no we did menidi anajo you say don't stress yourself so but aya na mpempi mistakenly na bebre mu bebre akotro enuro amanko for na afe nuru na ye de amano na because of say eduro na ye de amano no enye ade ebetimi atake the root cause nintino na akwa nipa na abaye blown diabetic.
Okay.
Yeah.
No, unim ukasa sesia na de ebe metimu yese. Enti say yete diabetes mellitus. Ye hu ne say is not a complete set to be a nipa no ya diagnosing say obi sana o chira.
No, any pre-diabetes.
Pre-diabetes.
That's pre-diabetes.
Enti say yete pre na. But the diabetes mellitus mean say ye hu say
any day
bibi sa e wo ho no. Talking about pregnancy and ya bound because it nature say a process ya nam baby ni yakodu baby ye betimi a classify say oba painful are mostly no share yes bra me nyin say ye no and na minya diabetes and no ye prayer na
no and you have something we call gestational diabetes and you during pregnancy it's almost say and empo at that particular point no say sa sugar no ekosro and glucose no kosro wo etimi be normal.
Okay. Inti brana wonyam na sugar na cholesterol na so glucose na cholesterol no. Ye medro for that.
Sure. And no we I say regulate on say yan regulate ya and no etimi ma say sugar na etimi fa placenta no mo. Etimi ma abofra no be ye kese. Inti abofra no ye kese ya ye difficulty of delivery. Inti abasa on timi enye enwo ono ankasa chi say yes. Yeah, and na ma ye regulate gestational diabetes no. Na on say yan regulate ya abofra na ye ba be won ye wonu wi a or higher risk of developing even type 2 diabetes.
Wow.
Yeah, and yes say regulate and that same can also lead to even the type 1 diabetes during the teen. Also type 1 diabetes it may be in all ages but more common with the childhood. As a yawo abofran one in the teen age no yeah e dey kono in a certain in this say ma minimum gestational diabetes na yan control or wo pe akola is at a higher risk of developing other type 1 or type 2 diabetes. And nti e say control it mu control ye wo an instant somewhere oba no time bia because of say the latter part of pregnancy no edidi a odidi ye wa nto no bo enidi odidi on say e man bi enyimo a latter part no they eat very well and time bia so person odidi and eno no etimi ma glucose no ekosro and eno no timi ma abofra no yekese nti eno no say anya CS ono ntimi ngoda because abofra no develop overgrown excess growth when yini abro size anke pen no ana say weight aye pen sen ko betimi ade apie no nti ebasa apeche say yes na yi da free and that same gestational diabetes no say ya hwe ni ya etimi the preeclampsia eba.
Okay.
And because of say, I want to say it affects as a year nimu you be explaining what idea say sugar no cholesterol niama eka e wo nipadua no I ma etimi di nipadua no enya no nti gestational diabetes no eno ye for one hour for you funu pre ni de ye nyina no ye ne enam ya ye mfa ye funu ya no ye betimi we can be diagnosed as pre-diabetics and that's the range you know the normal range between the normal range and the abnormal range that just say if case not you can be blown to total diabetes. Yeah.
Okay. Inti now no you share the root cause nankasa of diabetes ye betimi focus more on lifestyle and
yeah, root cause of diabetes no. Enye only lifestyle nko a.
Okay.
Ye wo empo ye wo even family line. E wo honum. The end ye wo environmental factors. Then over down one sana afi na ye ba be hwe our lifestyle, that's the food. Because glucose no comes into the human system from the food we eat and then our liver. Liver no store say we are liver you did aduane a starchy way na liver no store be something we call glycogen. The glycogen no and na liver no store into time I wouldn't need the liver breaks it down into glucose. Say there be a wouldn't need cra into a basa sugar and as a glucose I say bunny per for energy until the liver will break that thing down to glucose, then the body can make use of it. And to the more who didn't say OBCO and I'm no sugary drinks na and me for me dinner na yeah, it will keep storing it. And to time after we say live and best start to say well for certain to break those things down. Yes, a hormone after say glucose best at there. And I have environmental factors and so on, and also it may lead to that empocrano. So we your lifestyle no baby find say in conform stress or mo be brain because stress so stress na nya ba ni padua no mo digestion kra enya papa the digestion enya papa ninti no e kire say aduane a wo be di bia no the liver will have to force to store more of the glucogen no until store more then a little time I'll say a converse it has to break it down and release it into the human system and na ekobasa so stress no e can pancreas now when to me secrete and as when to me produce that hormone insulin no into the bloodstream to regulate your blood pressure and the hormone no sugar betimi akosoro and san ya san basa ye nuane ni de bebre pizza ni nyina anya correct so white bread and moody butter bread sugar ni nyina because they are highly one we say adeba ko woman say there's no fiber in them. And once there's no fiber in them, it's highly refined. And it's a wood dear. Send me glucose no si bat ni peduan 100%. And ni bibia a breaking it down. It goes straight. And the abasa a hat pancreas no. And it's a pancreas until jumaba from nowhere and me and secretary and that's when to produce insulin. I just say we sugar bed. Ebe koso. But any dakro and a sudden a koso. We will continue the aduane at certain time. Because liver and the continue, but if you have a start to say, we're breaking down or release it into the bloodstream. Now, if glucose no akosro, then pancreas no intimate secrete insulin into after glucose no ebekosro, then it will take over the human system.
Okay. Doc, Rebecca say excessive glucose and it lead to diabetes, Anna.
Sure, okay. It is. Sure.
So now, Brana Wokas and Wokai say moving forward, now Abim
good.
Excessive.
Very good.
What are some of the parts of the organs and on that? What are some of the consequences? I bet me apart from say ubenya diabetes.
Good. Always say a set in that way a high glucose no eba e can akomano. Yeah. We are it goes to the heart and then the blood vessels. And the person can develop cardiovascular disease. Enti akomayare obetimi nya akomayare bia. Enti wo hwe empempi no hwe enkofo a omu ye fully blown diabetics na obia da akomayare adruso. So enti akomayare bi te say angina pectoris ebetimi di aba, ebetimi di stroke aba. Ebetimi di almost say na blood vessels no I say emu ye narrowed e kwan na ba be ye ketekete no ebetimi so de eno so aba. So and apart from that, me can say with the cardiac aspect, no sad nyama we nyina ba itimi the heart attack nso eba. Yes, the same glucose na ko ni pedua no bruise we ni pedua no the heart attack eba. And as we are coming down, it comes down to the nerves. And you both say you will be to say diabetic neuropathy. And eba sa pe nerves no, nerves na. A hormone there are a lot. You both say nipa no etimiti pains. Ewo the nipa that's numbness, there's tingling. So when obi cry or what, kebu ye that way it's okase ontiasa ontiminti otiaso pe obebo form because pain now obe feeling intino. Enti ebasa akwa nerves no, then it goes down to the kidneys again. Yeah, the same high glucose and that you classified and said that. And when we say diabetes mellitus, that is a group of conditions. Then kidneys now it goes to the nephrons, and now said the glomeruli. It was set of kidney new set of arteries. Nkiti be a sonny. Eduane ye di no so enti eyi fi efri nipadua no say sugar no kosoro sa na say wasicire we nipadua no mu no ekosoro sa ekoka no nti afi ekoka no sa na afi amade aye inflamed enti wontimi nye na dwuma eyi enti ho na kidney so de ayedai aba enti bo say obekoni akacho say oh you are diagnosed with diabetic nephropathy. That is it. When we say diabetic nephropathy, let's say sugar na e woni padua ni munti amana ka that arteries no anase ntini nkitenkitena ka say sone efi efri ni padua no aka no nti afa honom so ni kidney eho aka.
I see. Obi betimi live with diabetes without any panel onimwana.
It's possible. Nkofo bebre wo ho a omo background with different condition. Afi yeah, I was condition nipa ya there na the blood pressure yes afi there. Wo be ye ne dem. Nkofo bebre timi the editrasa omunim.
And at what point and afi wo betimi I you betimi a diagnosis now no.
Yeah.
Oh diabetes.
So on say eba nipadua no mo ewo nsunsan so obi kakra. Tibos afa be kakra nipa no wo ho a ofili so benum nsuo ntentem onum nsuo ane nanum ay dry obenum nsuo ntentem na ebeba kakra na face ojonso ntentem obetimi ajonso mun yete obetimi akojonso bebre ohun se sa niema na ekoso a obon se na nipa no wo ho a na ofon wabra on try say obefon ntibos se nipa de obenya infections bebre because of say glucose no ekosoro a eka immunity no immune cells no enti se ba sa pe na yare bia etimi ba nipadua no enti infections ahodo na bebam bacteria fungi empo viral infections betimi aseti ewo nipadua no enti eba uhu sa niam na pe na infections bi ewo so yekoso treat a enye de enko na say quickly na obinsusu timinya ekuro onya ekuro no muda ye be ya ye hwe kuro na nya de ekuro no muda na no kire wo say say ehwe say nipa no glucose ayde to be kwa hwe na yede na wo so na de ba kwa say ehu kra ne say miane na amudidi na nkofo didi na ye nyina ye didi na ye kana people don't want to listen. They say the ade ba kwa wo ne say ye were glycated no eno ye deep serum sugar and sana aba index no enti glycated no obi o obon say obeba no ye be ye index no e normal but na glycated no I started the build deep into ewo emoja no eno no dangerous. Very very dangerous. Before I no cry baba be yin ho di aba anim na wonya conditions bebre. To was eno cry to me eno no ekosoro be ti nipa ntimi start say ojonso ntentem but because of say okọ ye test na ye be ye index no na omonko deep to the glycated omonka say nipa nkwa ye ne index no ye den onye diabetic but Johnson no kwa na e koso da obejohnson tentem sa it and then very dangerous with highly refined foods ni sugary drinks and comfort no me and even the energy drinks. What say energy drinks no has a way of even this stress eba cells no eba nipadua no and once I impose stress e wo nipadua it entina it immediate heart attack eba no yeah. And it's very dangerous to be consuming those energy drinks. They be I catch them say there's nothing like energy drink under science. No. Energy drink, what science are you take your fruit juice. The fruit will give you vitamins, minerals to boost the immunity and then to get your red blood cells being produced. Until you have enough iron. Na ahwodin aba. Until we catch us say anyway energy drink and ma ya. Say there are so many high meals of some chemicals combined until far instantly the energy will boost. But later, this is what it does. A bit drying of the arteries. The improper circulation, the narrowing of the arteries can also set in. And the people they live on these energy drinks most, many of them die with heart attack. Yeah. And you both say, see, I can say, we call station baby na mate be what Toby or the bread.
Oh, be on my driver be because so many kum. And my mentor no celebrate nikum no.
That is it. No go so air no. Tis any power obey me 28, 38 won't you say? Yeah, and no so can home and I call who says no. Say yeah, so very key to a bit. You was a member with Jamma. Yeah, a member with Jamma. The reason and they say see how share your man more. A member do do ne wo ho na no. they have these conditions. And when we say with diabetes, now that says sugar no cholesterol, it can nerves now at the erectile dysfunction ever. And this is here no some man, especially at the phone. Very good. Problem. And today piano or person or num a drop be a bema or bet me and the more I will num send runo now it is drying your arteries. Are they dangerous classes? Send no we say or more to try no bena diaphragm appetition are very dangerous. Or more to try diaphragm alcohol are very dangerous because sa abina yakotine say no put na draw more alcohol na day na yemani pedua. This is the question. It is over continue bedroom sadie we yan. Obe waja na because na num sa niama we. Well, enti ebasa yes obey na ya omusi o as a man titi mema no. And mema no suba no say to say. That is it. Because you were mema bebrea. Oh, you very nice with it. But okwa bontin a, the o abontin kra doso. Obe 2 3 wa bontin. Enti yes or num say nru we e betimi aboa no. Yes. You will be satisfied, but ube wager you're not because you may think say, oh, may one day I have my money, but you will die before your wife. Okay, and it's all you can afford. And man does it, man.
It's true.
You know.
Yeah, no. Okay, now you just so be what diabetes. You bet me determine how longer nipa ni bet me live. And I say, no dear, nya dear say passion a kumbia.
On said. Said the diabetes sit here no and no and yes passion na eyi free ho but idea you the human system will keep deteriorating nti wa ho den ne be start say e be from bebre because of the nipadua is prone to series of infections and conditions. Imagine we nipa kroya we diabetic we da anti-diabetic medication so we suffer antihypertensive medication, you have problem with the kidney. And a fully blown at that setter. A whole no money dear own shed and check because I want to say, I command ever born in your kidneys ever sonny, baby feeling in a one. So,
don't me, mammy, be some way and so. Said a baby because a name, yes, ye fat, ye nipa bed tenner, made him south of Saturn 2 3 4 when she no diabetes. It become makes me how many. A bro, yes.
18, 19.
Yes. And people living with diabetes, no. And near my ben, a money escalates, and as if a ginseng, na a worsen or more condition. What are some of the things that you lead to that?
I mean, that's also a point now we make here. Nanka diabetes, chronic him say type 2, no. Ebechi nkofo anke chimpenifu omonya 40 years and over but now echinkwala because of say some instant noodles no mu didi ni say nuane hunu no mu didi ni call restaurant call we say na say abola food enitinu ema
e kwa mama yenye healthy ones enye ni na e bola
we me ba make sure enti now can the lifestyle. One say, and I said, near my it's me a trigger. One say, we are diabetic, number one. I say, we share with DDME. Nebia and a woody. We are diabetic, I saw 2 free and some. We are diabetic, we will be DBiano, I saw to make it a whole food. So, and to make concoudi, especially Nanibia, baby to say white flour foods. And this would some meat pie, cakes, and it's both fruit to more achomo, yes, that's all to move him. Say meat pie, no, and both fruit to say whole wheat flour, and yeah, they are fine. Because there's fiber in it, that will help and require for digestion and then a much sugar near then it may bread assay. But Sankobasa white painful biscuit knee, Tanya Mania Mani dear, any dear, as or to move frame. Anything I want to say, they say I am more franda air banner. They were a feed you or mountain. One will say, Semenya 50 years, now say me feed me about wrongly this way. A likely sabo from won't see you. Oh, yeah. Because so she will be 20 years where diabetic, where hypertensive. Nema me anya 60 years. And maybe a radiama nema me best 70 or 80. And you possible say nipan won't mean see nema me no. Yeah. Sanity.
So one us one change.
One change in the lifestyle.
No, treatment.
Sure. Yeah.
Oh.
It is stress and so say stress and so eka hopa. They be a why busy. so obenya emre kra kakra gina hom ena ye yenso so the way ye stress free eniaman say oh and me sesi adem pese me gima home wodam pam no kita phone you are not resting because the more when ni echo screen no so no e the stress echo cells ni ye adwuma e the stress eba ni paduanum o pese ene o pese ojo wa home nyese bi ye necessarily say obeda o ubetimi akase oh an hour there me mfa me phone me nya hwe wo di ato silence da baby wo da ho keke ana wo te ho just relaxing so on your screen bia so your computer so hwe just an hour na hwe di sani nipadua wo de bia anya saa bre ne keke na hwe sani nipadua no e be sia respond and they say the ekoi nwanwa kra nipa na wo ko no na sum dede wo ho wo di airport omo friend is earpiece what they show dede o say kita phone no enti san kwala so mo anyini ancha you can blame obeyfo oh yeah that is what is going on. It is a basa di peduane ya stress. The stress is in your basa pe thorough digestion ubedidi so I'm even eating the right food but because of say stress ni woni peduane mo ntini unya complete digestion I betimi ama nutrient ni nyina be absorb then kidneys will work then after insulin no ebe boa ma even the glucose goes into the cell for production of energy so and what was say with people with diabetes na edru bebe ya obi be a friend of food damage because of say we no ekoka ye nerves no nerves no especially eka near wo ye nine no so hu ye ye nine no as anything that numbness ye feeling e wo ho no mebrebe no
is it food damage so meaning say the food I take you
foot
oh okay
yeah
diabetes ninya effect on our
yes because of the numbness no had to so be kwa na e ne ya pa and so afi opra enwuda
wow okay meaning say ebinom honum come after sa numbness no ebi sunya effect on their eyes
100%. Why are they pa no I said they have always say a stage where obewu say glucose na akos no it can your retina no and you won't say we see onipa no diabetic and as nipa no call eye clinic no you have been diagnosed with diabetic retinopathy that is it in sugar no and na glucose na cause on the account and I wouldn't say that glucose ya cause there's a stage I be do no and my depression is set when nipa do yeah you can face dementia that can also lead to Alzheimer's disease that's in the brain and it me can ya dwene no
for refuel
bia on cash and the glucose dey the pedenti you can say obi a diabetic enya ade ba ko anything that you have to be very careful you're diagnosed as diabetic patient treatment be near dey ma it is factors nyina say one consider and factor in you can't ultimately treat diabetic patient
doc say wunya diabetes and na munchire mu no mai hu say the nipediano intimi na say the right insulin is producing intimi so meaning say unya I mean orthodox way no na bi am apane obitimi so na full skin no awon
insulin no
what's your take on
but
that?
The truth is insulin now wo no and all those orthodox medication it is to manage the symptoms insulin no be why be do be wo kra enye ye bi that is the truth. On those that are diabetic, insulin, they will testify. Yeah. Baby no work still I didn't be costro.
Are they?
Yeah, because say it's insulin now out there no. And no yet the right hormone. I say a bit me abuani pedua, but I don't need to manage the symptoms at that particular point in time. No, now manage you. That is why almost say we be diagnosed with diabetic. Now you per se you treat you with the orthodox medication. We tell you say we can manage you. Management. And management they do baby a bejinsemu. I just say, what about hypertensive? No, about say I manage you. Oh, so I did cry. What diabetes no side and I say glucose no cholesterol say, and no say ni a sick kidneys no. Na ka akumano any blood cells no blood vessels no and no a hard bene pa because kidney ni say no kidney is supposed to regulate your blood pressure. It is a kidney no can. Akumano zo waka already. Enti atiti ena nipadua no. Enti diabetes very dangerous. Very very dangerous. But in near ma obeya ebetimi dia ba ye kire so twa ho.
yebetimi akase insulin na wo de wo ho no nipadua no with time nipadua no be hu no as a foreigner na.
Sure, it is. Say nintina wo na wo kwa ebre as ade no was no ebre na say. Utimi wo kra na wako hypo. Yeah, wo utimi ko hypo. Wo ya utimi ko hypo. Utimi ko hypo. Omo insulin wo ya opeduane adi. Because emma glucose no conform temp force na a for even they could go beyond the typical range. Yeah. Nti ebasa pe ene na eche say artificial. Ebasa pe ese nipa quickly ese we ingest bibi we di bibi na glucose no saba nipadua no for proper function. Enti say ye ka say insulin any that adene dia to manage your condition. The best part in the age na wo so say wo be didi ye men stress wo hu bebre ye nyina obi anka say won stress but I say opemre bi at least samre we die menyama me ho said ye be ya me so bibia mu frame kra me mfa
beto adwendwene bi so
that is a year adwendwene ko ba bi just relax obi your just an hour is okay na fe wa beto na we so bo se nipadua no ni cells no omo bro. Yes, we yes anema when you say how healthy the human system will be. But yet there be and say or there will be go one with share screens or kodakra and you miss share na zoom no share screen so will be crack to me and you soon the phone and no a format than a phone than in change. Which is very bad. They are very bad. You see, we have time for everything. And so if you want to live healthy, now you free I say we take it very good because I show a brabo ye. Did ye near one and to say, see, I'm your mofra now mobano. Tia yetiam nina say, Sanyama went in a yetiam. Imagine say about Freya Kwakoni Nima me during pregnancy, no, ni gestational diabetes was very high. Ena ebia yentimi control ni enti efa placenta no ma abofrey
ensoanya bi
good obeye kese obenyini obeye kese ntini eyese ye ne CS enti sa abofra no wonu wo at the higher risk of developing type 1 and 2 diabetes na abofrey ba ye oko school so sugar na ye feed no oko school instant noodles na ye de ma no oko school white bread nnuane ya po hunko na ye de ma no perfume rice na ye de ma no se wa yeah, but catcher say even this perfume rice is fortified with fiber. It's a lie. It is not true. The rice is already polished.
Dog, what can I say? Mamma, na wono be abofana son near yen CS a year abofano. Befana so you no. Mamma lifestyle no busua. And your nieces would do no they breastfeed abofano. Possible said through breastfeeding so abofano binya. There be better the woman said, Yakasa the child is at a higher risk. Say bibi bet me a trigger. Into any maybe can the breastfeeding no trigger a offering say diabetes? No, a honor there be but about front lifestyle belly you start to say oh dear. So then a old sugars and quantity the marble free. Candies a hodo and the marble free. I see if you say you pay money you, but these things are very dangerous. I wouldn't say diabetes no unyane drum pempen so but say you can even develop cancer. Yeah, it is. It is. We are diabetic. It will stage be a bedra. Yet mean cancer cells within you. And the diabetes na nyefe dia grow. I say you did near cow Korea protection near that. You know dangerous. They are very dangerous. People taking alcohol, no, they are also at a higher risk of becoming type 2 diabetics. Smoking, so it's
the same thing. Smoking what they own beer. Is that and now when you're the almost brothers, or more brothers, who the way jump because you don't smoke weed. Say, would you cause one and a day is coming. You face all the nobody will be any bit my catcher and say, well, you chain smoker. Cancer cells within him. A bean seed that. There's no chain smoker or catcher. No. A bean seed that. A bean seed that. A bean soon seed that. Because Nyami said there was saying Nipedriano. It responds to certain things that are good for the human system. Nyama be a nyama Nipedriano be a what can say nyebia. One no boy no nim no say 2 years for say. Sa nyama we enye. But yenya dream one say. Yeah, so smart say. Yeah, per se. Yenya nyankopon would adhere to yeni nia ye pe. na ye man ye no kre
o de ma ye paint wo ma dane no na nye e ba ye
ba me say Nyankopon hu you can't cheat nature. That is it almost as an yema hu no aye nyina echi na it boils to series of health conditions I attaching the pedian. You can say, oh, people using chemical fertilizers. When we near me adeba, and adeba comes they say, eh, me who crampo na ene sa eh nkofu no mo ye mango so many for no. They are a very bad practice no mo ye. Twa woni mo te mango green na. There's a chemical. Ah, mo digu mango no mo de motor kataso. Nti mango no beba ha no no. Na asa abre but who ye green. Very dangerous. It's a very bad act. It's better they should stop because we are advising people to take fruit. Now more produce fruit. Mangoes every so many. Now we can say 90% of them. Some and a kwadu. Kwadu. And you come market na so kaso koto kwadu. Ufa kwadu ni say no. One baby and ni san e soro ha no. Who say e green and the chemical as mento. Oh yeah, sad who cry a very bad. Kwadu green, kwadu mani nyini ucha na nyini now the two. Ebebre mu de haban kata so ebebre. Na ye by force you can brainti no with the chemicals that goes until we sa kwadu no. Na san say ni nyina e green. Ubu sa kwadu mo emu ye den. Mama nto sa kwadu no, who continue this kwadu, obe yare. Sa mango ye different so many ya omu the chemical. Who continue dia obe yare because yeah advises people should take fruit. I no interest Munkoye bibia fambre nkofo no mundi because those chemicals now when they can mango also mango is ready to eat something. Obi kura koto onsen or ruwa onsensene otimi di ene ni fiber very good. Ehunu ni nyina. Na chemicals ya apply on it. I mean and chemical no so na mango na bresa no. Wow. Ama brain nsuo abam very well.
Esa na ne time on so ye.
So ye.
Ni ya pre ama na.
It is mango no say ye twema ye white. You tell me white, but the can one on you. A big crash sometimes mango can say you try with the can a muki kakakra. And them so ye. Again, this can bread no. We are both the Romamo. People are willing. Say on bedi fruit. Namusumu we are the Amoko ye. Oh no, and ye nyakra, and it's so many for this better monster samus. Ye they want a back count. Yet me ba mo kra na munim say about. Ye want a back because see, send ye in Kofosi yare, a yare wo. Diabetes ya can one say me. Mofra when you nisika untimi hwe ho. Empo aduane a wo be di no as a diabetic patient no. Unisika you can't
because junk foods they affordable.
Affordable.
And no kwakonya yare.
Ukonya yare no.
And if doc said regardless if indeed you want to live healthier, it's very expensive.
Sure, it's true. That's the truth. Because of say ye because you see fruits are herb, vegetables are the chemical fertilizers are good. So people who say they are the same people imposing this chemical to us. Oh yeah. Omu imposing this chemical. Me base see me share obi ne wall echi muhaya mo chiri haya ebura omodua wall na chi wall line pa eburu ne fe no abo akese na me se hwe asase ne kra ye red den o e wall echi wo haya muhaya na me se so hu na we ye the chemical fertilizer ko gu asase ne so enti sa eburu na ba ye se na ehunu na nipa akodi na chemical ya na revise chemicals na ema eduane ne eba buruburu eba kese no e won so eduane no so ewrem te say body nyina o de fertilizers the egu ase chemical fertilizers go ase enti ye wo so many an ingredient or memo and answer empo component betimi ama ya ye organic fertilizers. What is preventing us? Say see if you be obewram bia Sunday bia me dem be fan Sunday bia go for di fufu yes nsene bayere ye nyoma bebre san nyama ni nyina ya de a enu anything na ye waste system no yes nke timi hu say also obekona brofo no omo dustbins we ye paper we ye plastic and na we ye food remnants good
metal can use
very good then omo de ye bisa hu say then omo because sa enuane no achi na aka ni nyina ye de ko ekoye bibi a beboa asase no
na even now most of the countries they don't use rubber, plastic bags. They use paper.
Paper, yeah.
So what are their paper more? Your doc messing about so be able to for and ye na ye did me ye be quiet to 05586568 99 eno any a call line obetimi afrɛ me na wo asebisa bibisa ene ye hwɛ diabetes mellitus enti sɛ wo asebisa bia me pacho fafa so na be bia wo ye diabetic patient kwan a wo fa so edidi ne wo pese wo nua ne bɛn na ɛsɛ wudi na maybe sa doctor say bia ye wo natural means of say ye dey cure diabetes and I say ni nyina just rely on orthodox medicine and also no say brother symptoms na no e the amount me so betimi afre me say I need the more afre me lower the volume of the television set na yen kasa mfa phone no say dey amete won kan ye na so wate me kama na doctor so dey anu ye ama wasem bisa no menya ofrefo frɛ me free eye malam but what me nka good morning sister ya.
Good morning, Sabna.
But I want to say. Okay. Nyame adomi nso ye ho ye pa.
Ka che doctor say me chia ne pa.
Ojoso.
Na okatafa gestational diabetes. Minyi me ye no minya bi.
Okay.
Na me kwa wo ye me wo kolebu. Ba me wo ye chi me kwa test ye me di no eko. Ba me ba me wo no me ye ne koye. Eko check ye na koye okay.
Okay.
But na doctor can say the wunya wo pa wo ba ne ampa me brɛ papa. Na me ba ne so. No way 4.8.
Wow.
0.20. Na before me be wo no me ye kan akara na me di 30 years. Me nya 3.6. But now I say it's true what not too much. Timi mu tell na ma e ba
yeah. Ain't finally no sister ya oh natural na say OCS.
Me wo natural na me brɛ pa me na me say
kafra.
Me my brɛ na me bisa say akala no e wo say ya sha check me say bibia e o obetumi assign
enya na okay yo me pacho ko so ahwe na ni nyina be depend na didie mu I hope say o man instant say na o man instant noodles
on the me actually me pesa na
okay
yo so na ka me mani bi
mate pacho ko so ahwe doc e be yi ano why me dasepa doc
so yeah any no say otimi hwe abofra no ne lifestyle me dey anya dey bibi na betrega enti ene dey na didie na na important ni obedie yes enti abofra no so ofa ne sa onyini no mutunufo no twe ne ho free sa say omomba be no nsane ade
okay doc your natural means to cure diabetes and diabetes even in alternative way no manageable.
Oh no, it's curable.
Hey,
Ninyina, it's curable. It's curable. Baby, to say empo with the pre-diabetes and then gestational ones, and then it reverse. Oh, say oh we, no say oh we ebe ko. But obi owa because of say ebi treatment range na nke say it exceeded. Enti afi oh we na say ani anko ho a na eno net. But oh we ya say itimeko. But there's a natural way of curing diabetes.
Okay,
yeah.
Doc, mesamba osubium. Amankwa FMS free Kolegono. Amankwa, good morning. Me bacha na ho tese. Amankwa me so chi wo free with television set na ho. Amankwa me nya feedback. Hello. Okay, abusuafo me so wo hwe me a na wo frɛ me a Dumu TV no na yen kasa mfa phone me ni die mu a said be a feedback ewo eho doc aduane pay pa na obies a wo hye yesisi o diabetes esese wodi
ye di kind say ye ka say whole food a o say atoko ye ntimi mpo ho obetimi di atoko no ka obetimi di akan bi ti say banku which is very good
say kinke
gonti ebro no obedi a say o limit ebro no enka yellow corn no the best
okay
yeah and na mempo ho say we yam any entertaining na wadi ni kakra nti say wo ti aduane bi ti say banche e na bayere say wo ti so e na menken so obeti so ba brode de obetimi adi senke ebenya mpo a wo ye diabetic so obedi fufu a e say wo bode nko a one say brode ne some ye wa eso
yeah
starch wom starch wom bode ye the reason why ye wa eso no starch wom ansa na iron no so ewom wo starch boom. Ain't he said,
no, wadaroma, mesa ma watu asubio. Christy, FM free, Agona Abodom. Good morning, Christy. Hello? Hello? Hello?
Hello.
Me pacho, what's a menka? Good morning.
Morning.
Me pacho wadaroma meet you.
Kasafi Agona Abodom.
Okay.
The firm Kwesi.
Kwesi, okay, yo. Kwesi meet you.
Pacho. Me deep bread, I show me some more once a budget.
Bread and a moody or hay.
Bread, yeah, it's somewhere behind the idea, sir.
Okay. Baby, I always say free na moje ba na se bia wo see anim a wo de ka na moje free oba.
Maybe I may was how mother do for him.
Okay, yo. Me pacho koswa hwe doke be ya no why. Hello. Oh, unfortunately, come baby bisa na say.
Yeah.
I have visited, you know, the dentist and when was the last time or ko check here. But the can also di brother na sim
yeah, the kind of visiting the dentist. And then the also empo obi a diabetic, your gum disease ho. Oh. The gum disease and the skin. It's we are diabetic. I want to say a catcher say a complex. To be a diabetic, and yes, visiting the dentist. Now, we so I say, if you are a situation was run and the glucose was run, and so a bit my eye possible to visit it.
Yo, near Kwesi Mesrawa, but modern acquire Sabiana, ko check near my doctor, Abosu, in as a own visit any dental clinic be at that dear me pouch. There's the time for Nako check it was seno. Na yen shed the entia Emma or gum no a blade. Yo, Mary, FM free at Tonsu. Good morning, Mary.
Good morning.
Me patcho now what to say. Okay, Mary patcho meet you.
Me patcho, my question is say, my sister back
okay.
Now for hospital, and a doctor who says I was taking sugar hospital.
Okay.
And see, I was say, on shane a HGMP or two quite into a clinic. And see, doctor is saying 2 weeks time, 2 weeks no summer. Na two I was all back to the beer or into a buyer and a call hospital. Our local into a 4 years and doctor as really say, all shouldn't be we and never do one of my own history into a shiny 1 month. Into 1 month or call a committee doctor for into doctor for no committee will say one call. Now I'm questioning Muchano and Granny Sugar. And see, or boy, or by the sugar was struck at her. Preoccupy a doctor and give it to a drugs. And the amount that so no diabetes and it may be something. And who made me answer with Diana?
Okay, but
when I say, I was so close to 1 metro.
What didn't fear saying? What didn't fear saying? Mary, why didn't fear say Mary? Tina that me pamucho. Doom TV no mame why? Madaroma. One make us a Doom TV no, and now they drum the cra. A business me penny AG. Mary Temenka because the TV no is so. Any dear mo mesramo. Mufra monya ne sama me why? Na man komo boni intimi ko wa no se de be obenya wasem bisana no ye why? Doc. Dear Mary Kenny.
Yeah.
I says we jai enro no enomo ana. Because based on said o see can dear. Who is saying nya de ana say ye sister na
pre-diabetes. But the woman say eduru wonya fa untimi nya na sao.
So
yeah, and this will be jaya empo no ye be regulating with the natural aspect. Yes, or but then she will be guided.
Okay.
Uja ne pet there will be something we call withdrawal symptoms. A bit me attacking the pedals. You can a bit me a costrama. Nipa be a bit me a sinti. We may enjoy a drone at a go upese ujaya bra hospital bra. Na yen show nian guide you. Nian show nia obeya kakra. A bit my be stable and the amount.
Yo. Amankwa sign frame free Afrebium collegono. Amankwa good morning.
But good morning, madam.
Yo, now what to say? Nyame adom yenso ho ye pa. Pacho meet you. Amen.
Pacho, but it doctor said. Don't me what diabetes. They say my baba 7.3 already.
Okay.
And so elidico am na cancer. It's a cancer for baba. And so me think na tia no na me ya me think for na cancer.
Sure.
I'm going to say,
Okay, I'm going to feel saying.
But my name is
53, okay. Yo, Pacho so I dog be yan why. May that say.
So,
Hey.
cancers be brave is coming from the glucose. Cancers be brave. Inpo more from 18, 20, a lot.
He says, I'm going to say, when you're saying the 9
yeah, I was a nam ninti odisiwa. Ne enti me pacho on your omra. Omra ya dia ebe betimi akọ ebe kọ na why free. Because I was a nam there's a setting e woni pedu anymore because of the nerves ninti no. There are a series of vitamins and minerals that will be administered. Nti obeye fine. But when we say ade ba ko so e wo ho a people feel. When we say wakọ hospital near see yakwako who said there's ketones ewa wo junsomo the moment abo say ketones woni pa no junsomo no me share even a health personnel on the interpretation of the mind no na e fall short the moment abo say ketones ewa wo junsomo e kire say there's unavailable insulin nti omo no fi omo say omo ka say ense nipa no ko hypo a na ketone no enti ketones ba obi junso ma e kire say ense mo ko quickly to the glycated na mo ko hwe
asem abedu me only for my last caller na me sam bro subio abedu your last caller from fit tamale good morning but you know what to say
Yeah, we you.
me pacho ane abedu pacho mitio
Yeah, we tell me all bad 50 years. Na ya diabetes and na ya na
okay
na
okay he says the national page umia na atom nyasa ena entimi so entwetwe
I can't question it means the nasty.
stroke is setting in.
Okay, me so koso ahwana tie asama doctor e wo man why me that say doc
Yeah. So in the ebase nerves no e ho aka say na say oh say the cardiac system is also and so no ho akire the cardiovascular issues nso ho na koma no entimi nya enti no won say o she mpabo akra etimi yi efri na say e kire say e ko na nim no say ya nhwe a stroke kra betimi asset in enti we dey edukra nim ne dey betimi ayama no say obomode na sa oba nyame yadom a ye ogidie say e be ye fine.
Okay.
Yeah.
Okay, nti abedu ye ba be wrap up doc e the number betu ja bomodena na fa na won ne communicate in free honum na ontimi mboa eye wo sister abusuafo yentimi for frefo bi abiem ye de enkomo twetwe na be wi ansa doc me so mama mo eni tete dia na fa bobo nnuane a sisi aso obi obetimi ye di na abo na nsa na ya ba wachira kwan no number
yo me that say won say me bo bibi ti say atoko say yentimi mpo ho ayuo nso ye mpo ho na say obedi wheat kra nya ne ya po ho be pano wheat sambia ya po ho ye fla na fro enye na ye bedi emo a brown rice na e good empo ye ne ye local rice ye wo ha empo fita no won say yentimi mpo ho bebre enko ton ne ya po ho bebre uton ne ya po ho bebre pe de aka nyina e sugar na wudi ko mu na eye say ye be no kokoo a enye ne ya so ne so enti hausa koko na e wa bonten e dangerous yeah because yes almost sonny so akopem empempensuo bi a koko ne ye no abie wo omo ye nsuo hie no mo di mole na o ma sonny so bebre no no mo di egu grawa no mo ansuo hie no no mo kan no mo di abesi abonten e say it is highly refined but sa koko no it would have been very healthy. But because of say omu yi ntetene nyina free wonti no what anom sa akoko we be ka che so sa akoko no me no ma sa akoko me fa sugar kra ngum e dangerous empo wan fa sugar ngum e dangerous na sesi a wasa akoto we wie no wo di sugar ngum o wie no wo di tea bread na edi na e to so sa de bo fruit e na enom ni baba ko no enti e kire say sugar be bre e na e ko ni enti mo say the people ni pa ni say o me kra me nya odefo me ni di ayi na nyam na wanya diabetes wonti ase. And you share uko into your communities here and go for cocoa pie diabetes will hop out. Oh yeah, because ni baba go pe onu go coconut ya sonne so tano what the tea bread was sounds
obi man no de ko se no
kromo ko se no mo the bread next
bi so no ma ya I know near Chini.
Nina, nothing.
I'm money a come.
It's a battle, but you went for Sunday. Now, so upesa onum drink beer, get your own fruit juice. Say your orange juice are fine. Banana and a wire and answer a carrot and the word juice beet and the word juice very good. And they say we ding her buy cabbage wo lettuce wo any sa k wo boko I live for any star shure you live you or shure a very good bar with vitamin C. A very good bar. So na eno ni nnuane a eyese wudie na wudi orange nso cramp na emu abane nyina emu aduane no wini nyina den efafra so kube a dry no also very good we are many chaff ni nyina that's the fiber I bet my den aboa ni paduane e ntwe won free sa pizza ni sa instant noodles sausages ni sa can food no and the perfume rice no e mo na mo person mo no just 2 minutes na aben no a very dangerous industrial way of feeding no you see say emre mpo no ya ka say emre ba na ye chire diabetes ni e ba be chire Minya sure some of them sabe kan ye be okay ya pamocho yo do ni di
do kansa na do we check kwambe tudwa no fa we fam tiawa emma me obi the message about say ojunso full times at night and ni sugar no 6.1 so that's why na 5.7 every morning anase
enti Johnson and we be man na oba
one indicate
Johnson tentem anajo no yes you go hwe glycated eno nye enti ye hwe glycated so ye be ma hwe glycated na se ye normal eni yes hwe ne renal system no ana se empo ne prostate enti oba nso so se ekoba se bi a Johnson tentem na ni range of glucose no 6.1 na ye go hwe glycated na enko soro a yes ye hwe se urinary tract infection na so that we can treat enti mo mfa ntena fie ofan bra hospital na ye hwe na ye hu ne ekona anko jinsem
okay doc but obi person oba a nature blender days time and one numbers
you that's it obesa oba nature blend clinical ye wo oyare for high tension ye ejuma from Monday to Sunday but from Monday to Saturday no 8 a.m. to 5 p.m. and on Sundays ye start ejuma after 11:30 near upon 4 p.m. na condition bia opese odi babia no ye wagidi se erade ya adoma ho beto but se oba na se a condition so ayentimi enhwa ye be refer to babia ye betimi ahwo na ho ade ato medical test ni de dodo na ene ye ewo ho but enye ni nyina ti uba na se yes test we yenye wa hanti kone koye wa hanefa bra ye pacho ema obumfu because yentimi nye ni nyina atego say ye almost 600 parameters are but yentimi nye ni nyina ti ebi wo ho a ye be mu akoye na wo de abanti uba ema obumfu na nya abotrema ena ye be stress so say ye wona wo ba ye ho no uba munya abotre kakra ema ye because wo say ye wo abotrema mo ba ya na emre no sometimes we say see a meti a make say before me kwa kodu na emre ko kakra enti me pacho omo ma ba omo te ho omo hwe me se si ano munya abotre bibia be fine
okay
enti ye number no 0262 556020 0262 556020 and also and that screen is ofra me na mefa na me ne waka esanso ye WhatsApp line to betimi asende o question bia de opese we ye bia betimi asende e wo so betimi join enso of Facebook Nature Blend Clinic GH na ya koso ayeden asua ade won say yare bia wo yare bia no ye nka nkire say men bompaye but please go to the hospital so
solution
me pacho mpaye de hu hia pa but go to the hospital please no basa no mo muntwa so
okay the whole number no
number ni bio 0262 556020
okay ebusia for Dr. Ibrahim Osman ubepiem e wo Nature Blend Clinic or no any CEO a wodano na ne yene ne twetwenkomo efa diabetes mellitus eho nti mesrew adamontuo no tu nyamea na eka se yensomfre no ne mu wabɔ nneɛma so a yenje ho nimdie nti kwayare sabia se wo diabetes a manage it well na de wo ho efi ho ntina tena fie na akoye ma wadura na no akosori na kuta paper no na okɔ eye pharmacy ne chemical shop me to aduro we ya no go to